COVID-19 vaccine, informational video, Operation Fight Back.
During the past year, COVID-19 has drastically changed our lives. Despite our best efforts with non-pharmaceutical interventions like mask wear, distancing, and hygiene, COVID numbers continue to be high. There's hope on the horizon.
What if I'm unsure about the vaccine? Is it safe?
You may be wondering whether this vaccine is really safe, given the time it took for it to be developed. I've been in healthcare for more than 15 years and understand the importance of having the right facts to make informed medical decisions for you and your family. Since everyone's risk tolerance is unique, I will share with you the facts so you can make your own informed decision.
Why are we being offered the vaccine?
The FDA recently granted emergency use authorization for the mRNA vaccines developed by Pfizer and Moderna. Realizing the need for the military to be ready, the DoD made it a priority to obtain these vaccines. Installations across the nation are administering them.
Am I required to accept the vaccine? Is it mandatory?
Under the emergency use authorization, you may voluntarily decide whether the benefits of the vaccine outweigh the risks. At this time, it is not mandatory.
How do these vaccines work?
These vaccines provide the instructions for your body to make the spike protein so that your immune system can quickly recognize and neutralize the actual COVID virus. This is not a live vaccine and cannot give you COVID. However, people have reported side effects commonly seen with other vaccines.
How effective are the vaccines?
Both the Pfizer and Moderna COVID-19 vaccines are shown to be about 95% efficacious. That means after your second dose of the vaccine, you will achieve 95% protection.
What are some common side effects?
Some common side effects include injection site pain, redness or swelling, headaches, fevers and chills, body aches, swollen lymph nodes, and feeling tired. If you feel these symptoms, know that your body is responding correctly and building immunity, and it should pass in a day or two. It's safe to take over-the-counter medications like acetaminophen or ibuprofen for any discomfort. If you're pregnant, stick with acetaminophen. Both the Pfizer and Moderna vaccine require 2 shots. You will be given a card to remind you when to get your second shot.
Who should not receive the vaccine at this time?
Millions of people have safely received these vaccines. However, if you have a history of severe allergic reactions to any ingredient of the vaccine, you should not get it at this time. Review the ingredient information on these sites. If at any time you experience trouble breathing, dizziness, confusion, or vision changes, please call 911 or get to the nearest emergency department. As always, call us at 805-606-CARE, that's 805-606-2273 for any medical concerns. Your health remains our #1 priority, and you are being offered the COVID vaccine based on the science that supports its safety and efficacy. We have been preparing for months and are eager to administer this vaccine in hopes that it will allow our society to move back to normal.
If I've had COVID-19, should I get the COVID-19 vaccination?
The CDC advises that you may choose to wait 90 days after natural COVID infection, as you probably have some natural immunity. However, there's no minimum wait time after a COVID infection to get the vaccine if you really desire one.
I have a history of Guillain-Barre Syndrome or Bell's palsy. Should I get the COVID-19 vaccination?
Guillain-Barre Syndrome and Bell's palsy are not contraindications to receiving the COVID-19 vaccine.
If I'm sick, can I get the COVID-19 vaccination?
We ask that you wait until you're feeling healthy at the time of your vaccination.
If I'm taking immunosuppressing medication, can I get the COVID-19 vaccine?
Yes, immunosuppressing medications are not a contraindication to receiving the COVID-19 vaccine. However, since your immune system is suppressed, your vaccine response may be less robust than someone who is not on immunosuppression.
What should I expect after my second COVID-19 vaccination?
There have been reports of more people feeling side effects after their second shot compared to the first. Most side effects continue to be mild and include muscle aches, fatigue, headache, and/or fevers and chills. Some folks experience symptoms similar to the flu and take a day off. If this happens, the symptoms should pass in a day or two and can be treated with over-the-counter medications. Know that your immune system is reacting normally if you have these symptoms.
Should I continue to follow COVID-19 precaution measures after receiving the vaccine?
So questions have been asked about the mask wear, the hand hygiene, the physical distancing, and whether or not we can relax those mitigations after the COVID-19 vaccine. Right now, the COVID-19 vaccine is another layer of defense. So until we have more robust data to really show that it is indeed effective at preventing COVID-19 disease, we ask that you follow all those mitigation measures as outlined in the public health directives.